Live where you live. This is ABC7 News.
Also, there's a new breast cancer detection screening available at an East Bay health system. How it might also detect some other cancers.
October is Breast Cancer Awareness Month, and joining us is Dr. Chen of Muir Health to talk about the latest advancement of breast health treatment. Thank you so much for coming in, Doctor.
Thank you for having me.
Okay, so you work with digital breast tomosynthesis. Tell us exactly what that is.
Yes, so it's a form of mammography that basically takes pictures of your breast in different angles, and it creates a 3D image or a 3D data set so we can see through the entire breast.
Okay, so talk a little bit more about some of the advantages of doing this 3D version.
So it basically is just a better form of traditional mammography. Using the 3D version, we're able to detect up to 40% more breast cancers compared to before, and at the same time, we're doing fewer amounts of recalls, meaning there's fewer false positives where we have to take additional pictures.
Okay, so for people who maybe haven't gotten to the age quite yet where they're getting these mammograms, how revolutionary is this compared to what we were previously doing?
Yeah, so it basically is just eventually going to replace the traditional mammogram that we've been doing. It will rapidly become the new standard of care.
Okay.
But from a patient perspective, the experience is almost the same. So when you walk into the room, it looks exactly like what a traditional mammogram is, and the whole experience is exactly the same.
Okay, so what is the ideal woman to get tested? We're starting now at 40, is that the age?
Yeah, so you know, risk of breast cancer increases as you get older, and 40 is a good age to start. There are different guidelines out there that have different recommendations, but basically everyone agrees that starting at age 40 catches the most amounts of breast cancer and saves the most amount of lives.
Okay, so everyone should have access to this. If they can get to their doctor, get a mammogram, they should be able to utilize this new technology?
Yes, so I would, talk to your doctor about this new technology. It's rapidly becoming more available at multiple sites. At John Muir, almost all of our sites provide tomosynthesis now, but it'll rapidly become the new standard.
Okay, and of course we have this, we go to the doctor, we get checked, but it's important to do self-exams as well?
It's a complicated topic.
Okay.
So mammography is more sensitive than physical exam, and there's a lot less false positives. So with physical exam, there's a lot of false positives that can happen. So obviously, if you have clear signs of a breast cancer, you shouldn't ignore it. But the guidelines are not as clear as whether you should be performing regular routine exams.
Okay, anything else to look for besides a lump?
Yes, so the clear symptoms are if you have a lump, if you see skin thickening or skin retraction, or if you have any type of nipple discharge. Those are symptoms where you should bring it up and talk to your doctor about.
All right, good to know, because I think a lot of times we just think of a lump, but there are some other things to watch out for.
Right.
All right, Dr. Chen, thank you so much for coming in and giving us a little insight on this.
Thank you for having me.
Breast Cancer Awareness Month. Thank you.